Okay, and we're in PPE, so scene is safe. We're going to start off by explaining the procedure to the patient, which we're going to be giving an IV infusion. We're going to check and make sure that the patient has got a site for receiving the medication. We are going to look over our equipment. So we have a sharps container. We have the bag that we're going to be giving the medication into. We have tape. We have the medication. We have a label for the bag. We have the needle for poking the bag, and then we have drop set and alcohol prep. We are going to ensure that the physician orders are correct, and we're going to ask the patient if he has any medication allergies to any of the medications we're going to be administering. We're going to go over our medication, make sure that it is the right medication, that we have the right dose, right concentration, and the expiration is correct, that it has a cap on it, and it is sterile. We're going to expel the air and make sure that there's no contaminants in there. We're going to go over our 5 rights. So this is the right patient, this is the right drug, this is the right dose and concentration, that the route is correct, and that the time is correct. Once prepping this, we'll get it connected to our needle that we're going to be hooking it up to the bag. Perfect. Set that aside. We'll take a look at our bag, make sure that the caps are in place, that it is sterile, that it is the correct solution, that the expiration is correct, and the concentration and everything else is correct too, that the clarity is good. We're going to look at our drip set. Make sure that it is untangled, that all the safety things are in place, and that the ports are on there, and that it is, sorry, excuse me while I untangle this. That it is sterile, and that the covers are on there, and that the drip chamber is in the closed position. Set that aside. We are now going to administer the medication into the solution. So we're going to clarify that this is the correct medication and that this is the correct solution once more. We're then going to, while remaining sterile, remove the cover on both that and the catheter. We're going to invert the bag and apply the medication at the right dose and right dosage. Okay. We're now going to dispose of the sharps and the medication. Oop. We're going to agitate the medication inside the bag. We're going to remove the plastic covers from the bag and the drip set. Connect the two. Fill the drip chamber. And dispose of any large air bubbles. They are disposed of, they are dispelled. We're now going to hang our bag. We're going to get our alcohol prep. cleanse this and connect the port. Get our drops correct, go to the proper drip rate. And close the other bag, the primary one. We're gonna recheck the drip rate, and we're going to label our new medication. And then we're gonna watch over the patient for the therapeutic effects and then any adverse effects.